The state health department reports 25 are pediatric patients. With children under 12 not yet eligible for the COVID vaccine, the highly infectious Delta variant puts them at added risk. And joining us live via Zoom is Dr. Donna Tiungu, an infectious disease specialist at OU Children's Hospital. Doctor, thank you for being here.
Thank you for saying my name correctly.
Thank you for pronouncing it during the break. Okay, I know that you can't talk about specific patients due to privacy issues, but really, how concerned are you about the Delta variant when it comes to Oklahoma children?
Yeah, I think many of us are very concerned. We know there have been nationwide outbreaks with summer camps and daycares. And we do hope that the Delta variant will continue to have low mortality illness for children, but rising hospitalization rates in children, cause us to have concern, and that we know that this could potentially be a larger problem in children this year than it was last year. So moving into our next school year without mitigation is not a good idea. And the AAP has recently come out stating that all students and teachers should go into schools wearing masks. So anyone over the age of 2 years old, and I would wholeheartedly agree with that. Also, I would strongly encourage families who are lucky enough to have children who are old enough to become vaccinated before school to do so.
Okay, and last year we didn't hear about very many children becoming sick. So is the Delta variant making kids sicker compared to other strains of COVID?
So we still have a lot of questions regarding the virulence of this organism and regarding clinical concerns. So any strain of COVID, it's possible for children to get very sick actually and have hospitalization, including post-infectious consequences like MIS-C or long hauler symptoms. Delta is concerning because the disease presentation seems different. Last year, many of our youth were completely asymptomatic and presented for care only in the rare instance that they were acutely infected and immunocompromised, or acutely infected and had some underlying disease like undiagnosed diabetes. But this year, we've already seen that previously healthy children are coming in requiring oxygen for COVID, which is unusual, and it's different than what we were seeing last year.
And we also saw a surge in RSV cases, which is not typical in the summer months. So when cases like that come in, how hard is it to differentiate COVID from other illnesses that are also climbing again?
Yeah, sure, absolutely. That's a great question. The new symptoms of COVID, so symptoms of COVID-19 have changed slightly with Delta. They are much more reflective of the common cold, which RSV, rhinovirus, parainfluenza, we've seen a surge in all of these viruses over the summer, which we don't usually see. These are wintertime viruses. So the new symptoms that we typically see with Delta are less of the loss and taste of smell, which was, kind of a trigger for all of us to know this is most likely COVID in the patient. And typically patients will have headache and cold-like illness. So yes, it's very, very difficult to differentiate RSV from the new strain of COVID-19.
And as you mentioned earlier, let's go back to this. Kids will be going back to school before we know it, but lawmakers have banned schools from mask mandates. Many health officials, though, are urging parents to go ahead and have their kids wear them. You said you recommended masks, so there's now a ban on the mandates, but what would you say to parents?
Yeah, I guess we need to talk specifically to parents, and all of us healthcare providers who take care of children are going to probably start sounding like broken records, because we know that our school leaders' hands are probably tied now because it's against the law unless a state of emergency has been declared for a mask mandate. So the American Academy of Pediatrics, who represents all of us in pediatrics, just came out yesterday and suggested that all people over the age of 2 wear masks regardless of vaccination status. And this is important. Universal masking is important for schools because even though teachers may be vaccinated, and even those over 12 who are vaccinated, they'll be prevented from having severe illness or hospitalization. They are not prevented from actual infection, and so they will be exposed to these younger children who don't have any vaccination whatsoever. So the risk is not zero there. So, and it's a great opportunity for teachers and older children to model what's good behavior in younger children who are unvaccinated during a pandemic.
Okay, so you recommend kids over 2 years old, so 3 and up, and good luck to all the parents of 3-year-olds keeping a mask on your kids. Boy, that is a tough job. Dr. Tiungu, thank you for being here.